Hi, thank you for the opportunity to present our successful initiative on improving radiotherapy inpatient activity-based funding at Central Coast Local Health District. My name's Emma Watson and I'm the Healthcare Improvement Partner and Activity-Based Management Specialist for the district, and I was the ABM sponsor of this initiative.
My name's Neilson. I'm the Healthcare Program Implementation Lead and I was the project lead.
And I'm Leanne Cowie, Operational Nurse Manager for Cancer Services. I was a member of the project team and one of the Cancer Services sponsors.
A clinical documentation audit by our clinical documentation specialist in 2019-20 financial year revealed that the activities of planning and providing radiation therapy to inpatients was not routinely recorded in our inpatient Powerchart electronic medical record. This meant that our clinical coders were unable to capture the activity due to inadequate documentation in the EMR. This was a problem as we were not accurately reflecting the complexity of care provided to our patients, and we were missing out on funding as radiotherapy specific codes attract a 39% price weight adjustment. Consequently, this was affecting our activity-based management results.
So the overall aim of our initiative was to improve the documentation and coding of inpatient radiotherapy activity to improve activity-based funding, and we had 4 objectives. The first, increase coding for inpatients receiving radiation planning and treatment from 50% to 100%. Second, to improve the accuracy of documentation of radiation planning and treatment activities in the Powerchart EMR by the nursing staff for all patients who receive these interventions in an inpatient setting. Third, increase the awareness amongst the radiation oncology clinicians about the impact of poor documentation on activity-based funding. And lastly, increase the awareness amongst clinical coders about radiation planning and treatment coding and access of information related to specificity from the Radiation Oncology EMR system. So a working party was established with representatives from radiation therapy, from coding, activity-based management, our cancer centre administration, our clinical director for cancer services and IT representatives from cancer services. And this initiative occurred during the first COVID episode, so we had to be flexible and moved to a virtual interaction, and we used Skype and email and phone calls rather than any face-to-face meetings or interactions. So we progressed to the diagnostic phase and used a variety of methods to look into our issue, including a review of the ABF data, and we gained the baseline measure for financial year 1920. We mapped the process to look for issues and areas of breakdown, and we identified the root causes, and these included documentation being primarily in the ARIA, but lack of access to ARIA for the coders. Coders use the inpatient Powerchart EMR as a source of truth, not ARIA, and therefore coders were not aware of any interventions. We found clinician understanding about ABF and the impact of documentation was limited, and also understanding around the coding process itself was limited. There was confusion about the different processes for ABF for inpatients versus outpatients. There were some issues identified with data collection. There were assumptions about the functionality of ARIA which were incorrect, and there wasn't any agreed process across the board. And we also found inaccurate recording of inpatient radiotherapy activity.
So our solutions, there were 3 potential solutions identified. All of these had potential issues which required advice from the sponsors and managers of the services. The final solution involved an agreed documentation process and template for radiotherapy nurses in the inpatient EMR, and the development of a new report in ARIA, which is our Radiation Oncology MR. The new radiotherapy nursing process progress note acts as a trigger for the coders. We also granted the clinical coders access to ARIA to view the report, which allows for improved coding specificity for radiotherapy treatment and planning codes. The agreed solution reduced variation in the nursing entry. It provided the coders what they needed for accurate coding and specific details on interventions. It reduced waste and duplication by using a process that was already in place, nursing entries in EMR, but making it work better and with less variation. And the solution utilised the resources available within ARIA to provide the specificity. So our results. The results of the initiative was an improvement in coding accuracy from 75% to 91%, and improvement in the radiotherapy nursing note present and in the correct format in the inpatient EMR from 71% to 87%. From 1920 to 2021, there was a 56% increase in the number of episodes with a radiation therapy code and a 40% increase in NWOW, a difference of 265 NWOW from 1920 to 2021, with no changes made to clinical practice. We also improved the radiation oncology team's understanding of ABF and the importance of clinical documentation. We now have accurate data which reflects the complexity of care provided to our patients. Additionally, it improved continuity of care as inpatient clinicians can now see documentation of a patient attending radiotherapy treatments and planning, which they previously could not see as it was only available in ARIA. And this relates to National Standard 6, communicating for safety. We do expect these results to further improve once the impact of COVID on our core nursing staffing levels is reduced.
So by working together, we're able to improve our documentation, coding, and funding. This has also had the benefit of reducing silos by bringing together different teams that had previously not worked together, which resulted in significant knowledge sharing. The coding auditors have agreed to include radiation planning and treatment into their regular audit schedule to ensure the long-term sustainability and accuracy of documentation and coding. The results of the ongoing audits are shared with the relevant stakeholders to ensure that solutions implemented are embedded into practice. We thank you for the opportunity and your time.